surprising to me was the excitement that our staff had about this application. A few people had access to it during the beta testing phase. They were excited by the opportunity, and it's just been a rare experience for me that I've been doing EHRs in behavioral health for 30 plus years to have staff express excitement about an application. We also found that it took very little time to train users. The providers, we spent 20 to 30 minutes with them prior to their actually doing a visit with the app, walked them through it. They went and did the visit, and some of them used the app right away, some of them did not. Came back to us and got additional coaching. With that kind of intervention with the staff, that kind of training, it was the whole training period was over within a couple hours. With our medical assistants, training was a little more than handing them the iPad. I hand them the iPad, show them how to log in to it, and point out, one or two things, and they were off and running within minutes. It hasn't had much of an impact on the workflow, and that's a positive thing. They carried a paper chart around before, now they're carrying an iPad. We haven't had to adapt their workflow to the application, which is typically the case with most software applications. The application was designed to go with the primary care workflow, so it's been very positive. We expected that, like every other primary care EHR implementation that I've ever heard of, that we would have a significant negative impact on our productivity. And we found this to be just the opposite. We had staff spending in the first day or so, spending about an hour more seeing patients. That's completely gone. There's been no negative impact on productivity at all. That was surprising and very positive. One of the things that we didn't think we were going to get in this first iteration of the app was automatic posting of charges. When the provider signs off on the iPad, the charge posts to Avatar immediately. Same with the procedure. When the procedure is completed on the iPad, the charge for the procedure posts to Avatar immediately. That's another time saving that we didn't expect to be available in the first release.